All right, when we're naming actions, just like head and neck can be used interchangeably, just like shoulder and arm, elbow, forearm, hand, wrist, now we're going to the lower extremity and we can see thigh, hip. The hip is the joint, right? The ball and socket joint where the head of the femur and the acetabulum connect, that synovial ball and socket joint right there. That's the hip joint. But when that joint is being used, what's moving? Well, the femur, or we call that the thigh bone or the thigh, right? So hip and thigh can be used interchangeably when we refer to actions of specific muscles, right? So hip or thigh flexion would be kind of raising your leg forward. It's kind of hard to show forward on this picture, right? Back would be hip or thigh extension. You can abduct it to the side, adduct it across the front or midline. You can rotate your hip, kind of turning it out or turning it in. So yeah, hip and thigh refer to the same action. Whether you want to use the joint, the hip, or the body part that moves as a result, right, the thigh. So we're going to start with the major prime mover here of hip flexion. That's kind of raising your thigh up or raising your thigh forward. So the muscles that are the prime movers of hip flexion belong to this group, and we call that the iliopsoas. So it has a lot to do with the ilium right here. The iliopsoas group, those are your thigh flexors or hip or thigh flexors that perform hip flexion. It's made up of two muscles that you need to know. Iliacus, that's the muscle that is right in that iliac fossa, right? And then if we move medially, there's this real thick muscle, right? You can see right here, that would be the psoas major. And both those muscles together, psoas major and iliacus, make up the iliopsoas group, which flexes your hip or thigh. Another muscle on this page is Sartorius. And Sartorius, we saw it earlier when we were looking at parallel muscles, those really long muscles that don't have many fascicles. Here it is. So you can see the insertion here onto the ilium. It's going to cross the hip joint. It's going to run across lateral to the medial thigh, and then it also crosses the knee joint. Right, so this is kind of one of those long muscles, weak muscle, because you see not many fascicles there, but it will produce a large range of motion, and it'll act on two joints, the hip joint and the knee joint. So what this does, when this muscle contracts, it's going to bring your tibia kind of up that way while bending this hip joint right here. So just think of crossing your legs, sitting down and crossing your legs. That's the action of the Sartorius, crossing the legs. Now it's complicated as far if we were to break down crossing your legs into action, the hip or thigh is going to flex, abduct, and laterally rotate. And what I didn't write here is the knee is going to flex when you cross your legs. So if you can just kind of think of that, Sartorius, crossing your legs. By the way, Sartorius means tailor. Tailor is someone who measures you for clothing. I guess this looks like a tape measure, kind of like someone's measuring your inseam, and that's where the term Sartorius came from. So the iliopsoas group flexed the thigh or hip. Well, the gluteus maximus is going to be the antagonist of that muscle because it performs the opposite action. So when this muscle here, the gluteus maximus, is the prime mover, it is going to extend the hip or thigh. And here it is right here, right? Kind of the butt muscle, right? The gluteal muscle, gluteus maximus. So when you think of thigh or hip extension, that's bringing your thigh back or posterior. So imagine lying on your stomach face down and raising your thigh off the table or the ground or whatever you're lying on. That would be thigh extension, right? And then if we move laterally, we can see there's another gluteal muscle. This is the gluteus medius, and some of it's covered because it kind of runs underneath a little bit, but it is more lateral. And we can see it right here, how much overlap it has with the gluteus maximus. So this muscle right here is actually going to pull the thigh out to the side, and the gluteus medius, therefore, is going to, this is wrong here. It should be abduction. Right, AB, so kind of make that correction, I apologize. Gluteus medius is going to abduct and medially rotate the thigh or hip. And think of turning your thigh inwards while it's moving out towards the side. Another way to think of it, lie on your side and lift your thigh upwards. The one on top, of course, lift it upwards. That's the abduction, but turn it in at the same time, and that's the medial rotation. So I apologize for this error. It should be ABD, right, abduction. The gluteus minimus is underneath it, so if you cut the gluteus medius, you can see the gluteus minimus, which looks identical to it, it's just deeper, is going to perform the same action as the gluteus medius. So these two sort of work together in abduction, right, AB, and medial rotation. The piriformis, which is inferior to the gluteus medius and minimus, right there, little wedge-shaped muscle. Well, there's the adduction, right? That is correct, but it performs lateral rotation. So the exact opposite of the gluteus medius. Adduction, remember this is supposed to be abduction, and lateral instead of medial rotation, right? And all of these actions are on the hip joint, and of course when the hip joint is being used, it's the thigh that moves as a result, which is why we can use these interchangeably. All right, and the hip joint or the thigh can also adduct, right? It can move towards the midline, so the muscles that exist in the medial aspect, your inner thigh, are going to pull the femur towards the midline, and that's what adduction is. So recognize these muscles as being your hip adductors, right? Adductors. There's 5 of them. The first, let's see, number 1, 2, and 5 we can label in lab because they're nice large muscles that we can see pretty easily. Kind of hard to see 3 and 4, but just know this group of 5 as being the hip or thigh adductors. First 3 are easy because they start with, or the first word is adductor. Adductor magnus, longus, and brevis. You can see adductor magnus, well, you can't really see it too well because of the angle, right? Of course, there's adductor longus, there's adductor brevis, right? And then we have a pectineus, it's cut right there, and then a gracilis. If we actually had a view from the medial thigh, it'd be just a muscle going straight up and down in the medial thigh, the gracilis, but you don't see it in this picture. In lab, kind of pay attention to that gracilis with number 1 and 2, because those are the ones we can see real well and label on the pictures of the models.